Lewiston City Council regular meeting to order at the time, place as advertised. Our first order of business is Pledge of Allegiance. If you'd please stand and join us in reciting our pledge.
I pledge allegiance to the flag and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Thank you, Council. We'll get right to it. Next order of business is citizen comments. This is an opportunity for citizens to comment on agenda items or other matters they wish to bring to the council's attention. Do we have citizen comments tonight? Okay, we'll move on to presentations. Roman numeral 4. Item A, October financial report. Financial report for October 2025 in accordance with Idaho Code 50-208. There is no oral report, councilors, unless you have a question. You are provided that report. Seeing none, we will move to the consent agenda. All items on the consent agenda are considered routine by the council and will be enacted by one motion. There will be no separate discussion on these issues unless the councilor so requests, in which case the item will be removed from the consent agenda and considered on the active agenda under items moved from the consent agenda. Councilors. Councilor Schroeder.
Oh, go ahead.
Councilor Forsman.
Motion to approve consent agenda as is.
Second. Been moved by Councilor Forsman, second by Council President Kleberg to approve the consent agenda. Clerk Rocky.
Council President Kleberg.
Aye.
Councilor Wright.
Aye.
Councilor Forsman.
Aye.
Councilor Schroeder.
Aye.
Councilor Klein. Aye. Councilor Spiegelmeier.
Aye. Thank you, Council. Thank you, Clerk Rocky. Council, next we move to the active agenda. Item A, Economic and Community Development Incentive Agreement. Considering approving a business incentive application and Economic and Community Development Incentive Agreement between the City of Lewiston and Elsewhere Properties, LLC, and authorizing the mayor to sign the agreement. I'm going to ask if Jerry Chavez, Valley Vision Executive Director, could introduce the subject for us. We have somebody from Cascade Plastics that has joined us on the phone, and he will be available for questions about the application. Jerry, welcome.
Thank you. It's always a pleasure to represent Valley Vision in front of council members for the city of Lewiston. My name is Jerry, last name is Chavez, President and CEO of Valley Vision. Before we introduce our guest that's in the wings waiting for brief discussion, I think the presentation is loaded up. A couple of comments, if I may, with regards to economic development. You know, in the world of economic development, companies like Cascade Plastics, and can you hear me? Good. Thank you. They have choices, right? And last spring, they chose to expand their business to Lewiston. What that really means in economic development was there's winners and there's those that didn't win. So it's always interesting. There are probably another community, probably not too far away from this city, that isn't in a conversation tonight about how they can support Cascade Plastics because they weren't obviously chosen. So a little bit of celebration, if you will, right? Because we do have a company that elected to invest their capital and start their business plan in the city of Lewiston going forward, much like Northwest Forest. But the request to you is very modest, if you will. When you think about those agencies that have the ability to incentivize companies, be it the state of Idaho, be it Nez Perce County, or the city of Lewiston, each of them have an opportunity not only to incentivize, but also begin that business relationship with this particular company. So look at it with regards to that particular point, if you will. As I said before, there's one community not too far away. I will not mention who that community is or who actually they didn't receive that vote of we want to expand. That's not part of this business, not part of this conversation. But when you think about the modest request before you, think about a long-term relationship going forward. With that being said, I'd like to introduce Wade Altendorf. He is with Cascade Plastics. He's actually on the Zoom call from just outside of Fargo, North Dakota. With that being said, Wade, the floor is yours.
I'd just like to thank everybody for here on our side. We feel welcome in the community. As you know, we just started building. We're looking for completion at the end of March. So we built let me take a step back. So our organization consists of 4 different companies, and we're primarily a Minnesota-based company out of the Minneapolis area. We have 3 facilities there, one in Chanhassen, one in North St. Paul, and one in Matamita. And we established a relationship with a company called Federal Ammo. And they also own Remington, and they also own CCI in Lewiston. We developed a relationship. We built a facility in Arkansas to support Remington, and we're following the same business plan to support CCI in Lewiston, Idaho. Our organization consists of about 130 full-time employees and about the same, not a little bit more temporary staff. And our 5th facility is going up in Idaho. We're due to take occupancy at the end of March, early April. And at that point, we'll be setting up machines, looking for employees, along with starting operations to support CCI. Paralleling those efforts, we're going to try to capture some market share on the West Coast because we don't have presence on the West Coast. With that being said, do you guys have any questions for me?
Thank you, Wade. Councilors, do you have questions for Wade? You can hear us fine, Wade?
Yep, I can hear
Okay. Councilors? Questions?
So we're building a 36,000 square foot facility in right next to a company called Pathway in the north part of Lewiston. I don't know if you've driven by the area or not, but it's looking like a real facility now. We got basically the parking lot done. The building is about enclosed at this point. So we'll be working inside very shortly. The primary function of the business is injection molding. We're injection molding the plastic components that go either into the ammo or the trays that the ammo gets shipped in and sold in. So you buy a box of ammo, the plastic tray, that's what our facility creates. We're an injection molding facility. We're looking to bring, we'll start operations relatively light. I think, we'll have 50% capacity. We'll be looking at 20, 25 people to start with. We'll settle in just over 30 people probably, and that's the likes of some at a professional level, plant manager, quality people, And we'll support technical areas. That would be like mold maintenance, mold setup. Basically, we'll establish a maintenance team. And then even entry-level positions where we will pull in people that want to start at the ground floor and learn the trade of injection molding, and we're willing to train and bring people up to speed and place them where they feel most comfortable and what they're capable of doing.
Are you handing it off to me, Wade?
Yes.
Okay, let me check with the council, see if they have questions for you or questions about the application. Councilor Spicklemeyer?
I don't really have a question for Cascade Plastics, more of the process. When I was looking through it, and it looked like they're covering a lot of things within the process, but I couldn't find the whole write-up on it. Is it only take one thing to qualify, or multiple, 5?
Counselor, I have a copy right here of the Lewiston City Code Section 440-5, and it talks about the evaluation. And I'll just read those quickly for the council and for everyone else here. But Section 40-5A, City of Lewiston staff shall evaluate an application for the Economic and Community Development Incentive Program, taking into consideration the following factors: revenue benefit to the City of Lewiston, number and quality of jobs created, strength of public benefit to the City of Lewiston, including benefits to existing businesses in the City of Lewiston by virtue of the proposed building being within the supply chain, or building in existing economic clusters such as ammunitions, paper products, boat builders, viticulture, value-added agriculture, or information technology. Number 4, ability of the proposed business to spur additional economic development in the City of Lewiston. Number 5, impact on the proposed business on existing businesses within the City of Lewiston. Number 6, the applicant's willingness to construct public facilities and infrastructure, including but not limited to parks, pathways, public parking, public open space, and public recreation facilities, either on or off-site. And then item B, after evaluating an application and within 30 days of receipt of a complete application, City of Lewiston staff shall provide a written recommendation to the Lewiston City Council, which you have as in the agenda item history sheet provided. And then number C, or letter C, the Lewiston City Council may adopt or reject in whole or in part the recommendation of City of Lewiston staff, or otherwise approve or deny an application for the Economic and Community Development Incentive Program based upon its review of the application and the criteria set forth in this section. So that's what staff used to evaluate this
Well,
application.
that's it, I saw that, but I couldn't figure out from that if it meant that they had to meet one in each of those criteria, or just all of them were a consideration.
No, it's my understanding they do not have to meet all of them. It's just kind of a package. Then they look at, maybe what's important to the project, because every project may or may not fit these equally. For example, the ability of the proposed business to spur additional economic development. In this case, this is kind of in the chain with CCI Spear and others, and other plastics that they provide. So they're clearly part of that chain. Somebody else coming into town could be a startup business doing something new that's never been done in the valley. When we talk about, it was up here, strength of public benefit to the city, item 3, including benefits to existing businesses. So they're looking for that multiplier effect, if you will. And it talks about, economic clusters, which we clearly have with our boat building in this valley, and ammunition, things like that. And then it gives some examples in here, such as ammunition, paper products, boat builders, viticulture, value-added, or information technology. So the staff will look at all of these criteria, and I don't have the weighting form in front of me, but they evaluate all of those to make the recommendation to council.
So, and on it, and I support Cascade Plastics. I think it's a great addition, and I support this. My thing's more of the process, and I'm just wondering why we don't see it more often. Is it the council, you don't tell us who gets disapproved?
Well, Council, I think that's a very good question. Part of that could be, and maybe we don't promote it as much as we can. We have worked closely with Valley Vision and let them know all the incentives that we have available because we're interested in having the businesses come here. I can tell you that Community Development Director Shannon Grow and myself are working on trying to update the application form that it would be a little bit more proactive. So we're going to try to include some of the Idaho Department of Commerce, at a minimum, links to those, but other incentives that may be available. Try to make the form a little bit more user-friendly, and I'm not really qualified to say that, but that's what I hear, is that it could be a little bit more friendly. We could probably advertise that a little bit more up front as a recruiting tool so that businesses know that we have it so that they don't miss the deadline, some important deadline on qualifying for some of these, which happens sometimes. So I think it's all of the above, but I do have a draft form with Director Grow right now we're working on, and we'll look at other opportunities too that we may be able to provide. They may not all always be financial. There could be something else involved too. And then there's some things that we're not going to waive. We're not going to waive equity buy-in fees and things like that. So there's things we can and things we can't do with this program.
That's good. I think it's a step in the right move, and I applaud Jerry and Valley Vision for all your efforts, so good.
Wade, do you have anything to add? Did I miss anything?
No, I don't think so.
Councilors, you have the Economic and Community Development Incentive Agreement before you. Councilor Forsman,
Motion to approve recommendation from the, oh, excuse me, I'm on the wrong one. Motion to approve the Business Incentive Application and Economic and Community Development Incentive Agreement between the City of Lewiston and L Square Properties LLC and authorizing the mayor to execute the agreement.
Second. It's been moved by Councilor Forsman, seconded by Council President Kleberg to approve the Business Incentive Application and Economic and Community Development Incentive Agreement between the City of Lewiston and L Square Properties LLC and authorizing the mayor to execute the agreement. Clerk Brockey.
Council President Kleberg,
Aye.
Councilor Wright,
Aye.
Councilor Forsman,
Aye.
Councilor Schroeder,
Aye.
Councilor Klein,
Aye.
Councilor Spiegelmeier.
Aye.
Motion carries. Thank you, councilors. Thank you, Clerk Brockey. Wade, thank you for joining us here tonight. We had a successful outcome for you, and we look forward to working with you in the future.
Thank you so much for taking the time.
Thank
We
you.
look forward to coming to the community and having a presence.
Thank you and welcome. Jerry, thank you
Thank
for
you.
your,
You're welcome. Thank you.
thank you for working with the city on this. I know you spent a lot of time with Shannon, so we appreciate your efforts too.
My
Thank
pleasure.
you. Council, next up, we have item B, recommendation to modify out-of-area ambulance transport fees. Considering a recommendation from the Emergency Medical Services Advisory Board to make amendments to the Lewiston Fire Department's fee schedule for out-of-area ambulance transports. This is an action item, and we have our fire chief with us here tonight, Chief Greg Reitmeyer. Chief, welcome. I'll turn the floor over to you. Please introduce yourself for the record.
Thank you, Mr. Mayor, Council, Greg Reitmeyer, Fire Chief, Lewiston. And I also have with me Mike Larson, who's the chairperson of the Emergency Medical Services Advisory Board. You have a letter for you explaining the MSAB's review of the issue that's before you and their recommendation. Stand for any questions. Mr. Larson.
Thank you, Chief. And Councilors, I guess we're going to throw it open to you for any questions to kick us off. Councilor Spiegelmeier.
Thank you, Mayor. So Chief, the biggest thing I see in here, and I appreciate the letter and stuff from the board, but is it really realistic for us to haul somebody from Lewiston to Seattle in our ambulance, in our firemen? Is that realistic? A 14-hour day?
Is it achievable? Yes. it is.
Achievable, realistic.
It has been done rarely in the past. There's a couple of specialty centers in Seattle that you can't get anywhere else, Children's Services, Burn Center, and things like that. I would say that nowadays, because of life flight and their availability in our community, is fairly rare. The Burn Center the burn services in Spokane are limited. So the Burn Center in either our nearest two burn centers are Seattle or Salt Lake City. And so Seattle's available by ground if the weather's very bad.
Follow up?
Counselor Spickelmeyer?
So with this, when we get paid for it, does what we get paid justify our expenses?
It's kind of a loaded question. I wish I could just say yes or no. It just depends on the patient's insurance and what that coverage is. It's also really difficult to track because it takes about 2 to 3 years for all of the insurance billings to clear. And so when we're looking at, we looked back, we did a 5-year look back that's in your chart there. And we've got one call to Boise in 2023 and one call to Chehalis in 2025. Other than that, it's really the Spokane, Coeur d'Alene metropolitan area that we're talking about. I think that it's MSAB's feeling though that we want to leave that decision-making ability with our battalion chief that is on that day, because to write a policy that's all weather, all road conditions, all inclusive, and the patient specifics is really difficult to do. So we try to give them some guidelines and the 14 hours is one of our guidelines. Also, we like people off the road before 10 o'clock at night. It's just been shown, we use that in wildfire as well, that that's when our circadian rhythm really starts going, saying it's night time. So we try to avoid both of those.
So follow up?
Counselor
So
Spickelmeyer?
in the LC Valley, there are no other ways for people to get a ride to their special services.
There are, and that's primarily life flight. And when life flight can't fly, then it's ground transportation. There's one private company in town that at times can provide that service. And they've had a rash of mechanical breakdown problems. And so it's kind of day to day when they can take those patients and when they can't. And Clarkston Fire Department too, I'm sorry, but Clarkston Fire Department takes those out of areas as well.
Counselor Wright?
Thank you. So reading the Q&A, there was, I was going to ask, do we have any contracts with medical facilities or physicians, but I saw the answer to that was no.
That's correct. And it's an interesting question. I appreciated getting it. I don't know that the hospitals certainly don't have the responsibility to get a patient to another hospital. They are a partner, however, in wanting to see better care for their patients. And so when we're shipping somebody out of the valley, it's because they either don't have the staffing. For example, 2 weekends ago, our cath lab was shut down at St. Joe's. So if you had a heart attack, you had to go to Seattle, or sorry, not Seattle. You had to go to Coeur d'Alene, to Kootenai Medical there, or to Sacred Heart in Spokane. And so, we took several people that weekend, and so did Life Flight. It's just, we don't have to do it as much, but you'll see in there, as little as 10 years ago, we were doing 400 to 500 transports a year. But because of Life Flight, because of, frankly, the doctors like Dr. Kim, we've brought in some incredible physicians to our local facilities. We have, now we have kidney dialysis at both hospitals that we didn't have before. And we have, both hospitals have multiple CT machines. That wasn't the case before. So we're able to keep and treat a lot of patients here in town, but sometimes we just can't.
I'm going to follow up on that.
Counselor Wright?
Thank you. So what I was getting at, so if we don't have the contract directly with the facility or the physician, then only two other things would make sense to me. We deal directly with the patient, which I saw that was an answer in this as far as reimbursement is concerned, or we have some sort of a contract with another government entity like the county or the state or Lewiston County or something of that nature. So kind of a two-part question here. When it comes to our reimbursements from the patient, who do we contract to pay to get the billing done? I assume we're not doing medical billing ourselves. We're contracting to somebody to do the billing for us. And then my second question is, do any of our mutual aid agreements with other governmental bodies have this type of service involved in it?
So to answer your first question, all of our ambulance billing is handled in-house. We have two people that work in our ambulance billing division and take care of all of those services. And so we bill the patients directly. To expand on that just a little bit, we bill, the patient's insurances and so forth and go through that. And then there are laws that are involved called balance billing that prohibit you from billing past the patient, what the patient's insurance pays. And so that's the medical world we live in. You just can't recover that. And when that balance billing originally hit the country, it exempted aeromedical and it exempted ground and medicine transport. However, that environment has changed for ambulances.
So sorry.
Counselor, please.
So we're not allowed to bill out of network if we don't agree to the terms of an insurance company. We're always just in network with them?
And you're speaking the language, the legislation prevents us from billing the patient. It's not the insurance agreements that do that. It's the legislation that prevents that. And so it's an interesting thing. Medicine is not, we hear that our medical system's broken in America, and that's one of the places where we see, that's where it's hitting us locally is, they don't pay the whole bill. They don't. But if I may, just real quickly to follow up with your other mutual aid, our mutual aid agreements with Clarkston. Clarkston's the other transport for service company or agency in town. And they also bill for service. They do contract out to a company over in Paulsville that does their billing for them. And in Lewiston County Fire District also does some transport for billing, and they also use the Paulsville-based company. Get both your questions, sir?
I believe so. So we're not in a mutual aid agreement with Clarkston or Lewiston to do out of area transfers for Clarkston hospitals.
No, when the hospital, the tri-state will call them first. And if they don't have the staffing, then they'll call us. And if we don't have the staffing, they call around and try to do what they can.
Thank you.
Counselor Forsman?
I'm trying, so I know we talked about, or obviously the MSAB meetings and stuff, the billing and when you cannot bill the patient. I thought that was only for like Medicare or Medicaid type, or is that just everyone, no matter what kind of insurance that you had?
Medicare and Medicaid are required at the federal level. And then the state legislation is what requires you to accept the assignment from the insurance companies. So really, the person that pays the full bill is the person that doesn't have insurance.
Got it. Okay, thank you.
Counselor Wright?
Thank you. The other thing that jumped out at me a little bit when I was looking at this, there was an example in the, kind of trying to explain what this means. And I believe the example was talking about picking up someone in Uniontown and transferring them somewhere else. I'm trying to get a grasp on how often are we leaving the valley? And I'd say for the moment, let's consider Clarkston the Valley in this question. So when are we getting out of our Lewis-Clark Valley to pick someone up to transport them to another hospital? Are we doing that?
Our primary service area, so the portion of Whitman County that's Uniontown, Colton, and then Asotin County and Nez Perce County. Those people get transported down to the valley, with the exception of Colton and Uniontown, because a lot of those people seek their care at Pullman. And so we'll run those people up to Pullman Regional and then come back. But we don't take somebody from here to Pullman Regional. That's not from the field. Now, inter-facility, that could happen. You could get a call take somebody from St. Joe's to either Gritman or Pullman. And those are usually when there's no beds available.
Gotcha. And I'm more curious about because I could understand if one of our, Lewiston residents needed transported and no one's available, and so we ration some of our finite EMS to make sure they can get where they need to go so they don't die. Like that makes sense to me. But if we're going to other towns, other counties to pick someone up and bring them here or take them to Spokane, then I'm starting to wonder, like, how much of responsibility is getting laid on us from all these other places? Sort of what I'm trying to understand, what's going on in this area of out of area transfers.
Oh, absolutely. And this is one of the things that we've been stressing with our staff lately. And we've got a meeting set up in January to have with the leaders, either fire chiefs or ambulance directors from Clearwater County Ambulance, from Moscow's ambulance service, and from Pullman Fire Department, just to make sure and reiterate that our expectation is you take care of your patients. If you, like, just yesterday, we had a patient in the Pullman Hospital called us to come get a patient and bring him to Joe's. And our battalion chief said, "Have you called Pullman Fire Department?" And they're like, "Well, no." I said, "Well, how about you call them?" And so he called Pullman Fire Department. They said, "Yeah, we're happy to take the patient." So we're kind of clarifying that. I think that's probably a staff training issue at the hospitals, that we have to do that. Our staff is clear on telling them that that's not our mission. I wouldn't say it would never happen. If somebody is, we had a couple of weeks ago, somebody was at Gritman Hospital. It was a Lewiston resident that was at Gritman Hospital who had a severe cardiac problem, and they were transferred. We went up and got them, brought them down here. They went into the cath lab. They weren't able to fix it. And then we took them the next day to Spokane for open heart surgery. And so I wouldn't say it never happens, but then that's where the battalion chief, medically trained, understands our system. We don't strip resources out of our primary 911. This is done with off-duty personnel. And it's something that we've done since the inception of the ambulance. It's just recently that it was brought to our attention that the city code was a little ambiguous on the statement in there. That it could be read that was specific to limiting to those cities that were listed, rather than those were examples. And so that's where MSAP provided the recommendation to add on to that statement, so that it's clear that those are examples of common areas. However, it's not meant to be exclusive.
Just one more real quick. So thinking this through, I mean, the SOP 609 doesn't mention a scenario like this, and it seems like a major lacking piece of an SOP because I get it how you don't want to describe, what, depending on what the weather is like, but saying if patient is in this location, this body's responsible. If patient is in this location, this body is responsible. And an order of operations, like life flights first, then this company, then us, a very clear, like, here's the chain that we follow to make sure we're not interfering with the private sector, that we're really just in this space as a last resort for our residents, so that they don't, pass away or suffer because they can't get to the right hospital when they're in our location. But those are things that, yeah, it seem like they could be much more clear on what is the mission here and what are the guidelines around that mission.
And, yeah, capture essentially a hierarchy of decision-making, which is, we have to work with the hospitals to do that. They're the ones ultimately making the phone calls, and we get staff education.
Thank you.
Chief, I want to share with you, and I'm sure you know this, but the question was asked earlier. But for Clarkston, in their code, it says out-of-area transport. It says within a radius, including Spokane, Coeur d'Alene, Walla Walla, Orofino, and Grangeville. I think that's pretty clear. And so I guess I would ask the question, if there's a patient, excuse me, let's say it's an Assault County patient and they're over at Tri-State, and they need to get to Seattle, and City of Clarkston says, we're not doing that, it's not within our transport area, they're going to call us next. And so why would that be the City of Lewiston's responsibility then to provide that transport? And I ask that because our city code that governs the Lewiston Fire Department and ambulance services applies within the corporate limits of the city of Lewiston. Anything outside of Lewiston is a whole new business. And we don't have any kind of a code or agreement or anything that would cover that. So if Clarkson's not going to take that, why does that then default to us?
I think the simple answer is it always has. And from the fire service standpoint, we're in the business of service and delivering service to the citizens that need it. Just because somebody initiates a transport at Tri-State doesn't mean that that's not a Lewiston citizen, Lewiston taxpayer. And we haven't been in the business of checking addresses or checking residency.
But Chief, it won't change. If it's an Assault County resident sitting at Tri-State, they need to get to Seattle, Tri-State's going to call us.
That's correct. And I think that that's before the city council. This is where we need you to determine what services you want us to provide. Historically, we've provided this service. And, I think it's a tough decision when you're trying to make those choices. I think to make those choices when you're talking, one call every 2 years, when that's somebody's life on the line, it's a tough decision. And I think that perhaps it's just nobody's wanted to address it before. It's like we take care of those when they happen, and then we move on. And that's, I think that's what MSAB is making a recommendation as an advisory board with a lot of medically based people on it. And what we have for you is to help us guide that decision and how you want to proceed with that.
So Chief, if I can have a follow-up to that, and Mike might want to answer this, but so as I read this letter, and it says, in the first paragraph there, it says purpose of out-of-area transports. It says Lewiston Fire Department provides out-of-area ambulance transports to meet a critical community need. That need is ensuring patients have access to definitive specialty medical services. So my question is this: what are definitive specialty medical services? Are these emergency medical services, or could they include non-emergency medical services?
They include those non-emergency services. Definitive care could be that there's no hospital beds or not enough nursing staff here for somebody who just needs to spend 3 days in the hospital because they broke their leg. And so that person may have to go to Gritman or Pullman to find that. And sometimes those patients come down here when there's no beds. So definitive care is just that. It's where are you going to get the care that you need to complete your medical course of treatment.
I appreciate that, but it doesn't necessarily mean an emergency, though.
No.
Yeah. Okay.
A lot of times these are non-emergent transports that they contact us and we schedule them out the next day.
Counselors? Questions? Counselor Forsman?
When type of calls happen, is there a report having to be written up? And if so, then who is it given to and who reviews it?
So every one of our medical encounters that we have with a patient, there's a patient care report that's written in our electronic system. That patient care report is left with the patient or sent to the facility where the patient arrives at. And then we retain a copy for our records retention.
Mayor, follow up.
Counselor Forsman?
Is there confidential, maybe HIPAA type?
Excuse me, Counselor, would you turn your microphone
Oh,
on?
thank you. Is there any HIPAA type violations or type information that you could not, like, when we have these, then you report it to the mayor? So the mayor reviews, we had a review call, this is why we had to do it and what, why we made the decision we made. Is there a way to give that kind of report without compromising the patient's information, private information?
We can give summary data, but it is protected by HIPAA. There'd be certain things that would be protected by HIPAA.
Okay, thank you.
Counselor Wright?
Yeah, so a bit of a follow-up on the mayor's question there, when it comes to non-emergent transports. So I'm worried we could be on a slippery slope to an extent. So we're covering for a need because the private sector is not adequately providing it or providing it in the way that the hospitals at least want. So what about when the patient needs to get home and they can't call a taxi? Are we providing that as well?
Inside the city, on
Yeah.
occasions, we take people back to their residence or back to their nursing home, yes.
Okay, that's, because that sounds like the next step of something like this is you, not just another hospital, now you're taking them to back home because they can't be in a normal car or they don't have their own transportation. And then we're, kind of a quasi, I don't know, it's not EMS anymore. It's something different. You have to have trained staff to transport in those scenarios, but it seems different from the main mission, at least. So
It's been when you look at our history, the reason that the city chartered the ambulance and we started providing care was because the private company in town left. All of a sudden they're gone. And so it's one of those things where we don't have the volume. It's not a money-making enterprise to begin with, and we're seeing that play out in Seattle right now with the private companies there. They're either raising their rates they've raised from under 1,000 to over 5,000 in 5 years. And I included that reference, and there's a link to the Spokane Review newspaper story about that. You see that, or they're approaching the city of Spokane and saying, you have to give us more money in order for us to stay in business here. So it's a tough spot that we're in, and we don't, if you try to get an Uber or a Lyft in town, there's not a lot there. There was a gentleman who ran a medical taxi service for a while, but he wasn't able to make his payroll and pay for fuel because it took so long for the medical insurance companies to reimburse him. So there's a myriad of need that I think, when we look at integrated healthcare systems, mobile integrated healthcare systems and things like that, that we would love to forge into and learn more about and see if there's some answers there. The need's there, I'd love to find a way for us to meet it without using emergency services to do that.
gotcha. So just a clarification. if I may.
Counselor Wright?
So the intent of what's before us tonight is essentially to say, the example cities, counties given was not a order limit of this document. It was just examples and out of area is more about the 14-hour round trip timeframe, not about we won't go to Montana or we won't go to Spokane because it's not on the list. And it's just to clarify that, essentially.
Correct. And that's the ask for tonight. When this came up in October, we put out a temporary halt for our folks. And, you know, right now we're following the letter of the law with the exception of Coeur d'Alene, because that's where the Heart Center's at, is at Kootenai. So we just want to be able to, you know, as the mayor brought up, is to operate within the code and to be meeting the intent of council. It's fine to say, oh, we've always done it this way, but if that wasn't the intent of historical councils or the current council, then we have to change what we're doing. And I think that, you know, if the council would like us to go further and want to have that communication back with whoever's going to be our new MSAB member from the council, and we can work towards some of these things. It just takes staff and time to investigate and learn what's out there and what we could do, have meetings with hospitals, have meetings with other providers.
Yeah, sounds like we've got our work cut out for us, for sure. Thank you.
Counselor Wright? Or Speckelmeyer, pardon me.
Oh, I'm on your right?
Yeah. The counselor on the right.
I guess for the council, it sounds to me like there's a lot of questions and concerns. I'm wondering if we should table this and have a better discussion in a work session to where we talk about the city's obligations and the impacts.
Mayor?
Counselor Klein had a question next.
So what I'd rather see is a better list that actually is realistic to like where we've actually taken people. Like when it says basic life support, maybe sticking to more of the local if it's just basic. And then the advanced life support, maybe, you know, noting that we could go to Seattle if need be, if it's really an advanced situation that we're the only ones available to do that, for Lewiston residents, making it more specific instead of making it more open.
I would say, I echo that. I was going to say, I think we should give them direction versus tabling it, give them a direction to go back and kind of crack at this more and bring something back to us to discuss at a work session, I think would be ideal. But I did have some questions. And one was, and I'm trying to remember the name of it that cities call it. Is it community medic services or?
The umbrella term is mobile integrated health. There's community paramedics, there's community EMTs, there's social work. It's an entire branch of services that are available. Clarkston has a grant from Greater Health Now, which is a Walla Walla-based organization. They're looking into expanding that. Have a desire to work with local folks to do that. And we just frankly don't have the resources to investigate it and apply for the grants and do the work that is necessary.
So I know that those types of, those types of services are what Counselor Wright was kind of referring to, transporting someone back to their home, it's not emergent, even picking someone up from from, let's say, the nursing home to get to the hospital. Also, not always an emergent situation. They just need to get to the hospital and they have no other way to transport them due to lift situations, needing more hands to help them. I know though that would solve, well, I shouldn't say solve, but that would assist those types of patients, alleviating the fire department from actually emergency type situations. So I would highly encourage as a council that we really look into how can would we be able to implement that, whether we try to find an organization that wants to do that, or do we get grants? I know other cities, that's kind of what they're doing to still provide adequate patient care as well as trying to offset the cost, because obviously that is a concern, is the cost to the city, and but also still providing adequate care to those that need it. And we have a majority of elderly population here, and so we do get a lot of those. Last I remember, we get a lot of those types of calls due to that kind of demographic. That would just be my suggestion.
Council President Kleber?
Well, as somebody who was, what, 2.5 years ago, critically ill down at St. Joe's, that'd be me. And we didn't have the proper personnel here in town to take care of what I had going on. And by the time I got done screwing around with everything over there, it was late at night and I was put on life flight. Now, I was expected to pay for, I think we're missing the point here. I think part of this discussion also goes to, are we getting paid properly for our out-of-area transports? As you're saying that, we can only bill for so much. I was on the hook. Fortunately, my wife and I have the flight insurance and we've bought it for our kids. And we've been $85,000 that I'd owed out of my pocket. And they didn't come down and pick me up after a month and a half or 5 weeks that I was down there in the hospital and rehab before I could come home. So, but it really, I think it missing sight of the goal here. I mean, we're bleeding out. We've been providing a service and we're not getting properly reimbursed. And it is the taxpayers of the city of Lewiston that are paying for other people's transports. That's what it boils down to, in my opinion. You can correct me if I'm wrong.
Counselor Spickelmeyer, you asked the question about tabling it. You can certainly make that motion. It takes a second and it's not debatable, and that's up to you.
If I may, before that motion, I think you guys are in a tough position. And I don't think that you're in the position where you want to make patient care choices. And unfortunately, that's where you've been put. This is our busiest time of year coming up. And I'm happy to bring this back to a work session. I would offer that this exceeds a work session. This really requires a specialty work group to dig into, collect data, look at all of the different questions that you guys have. And I don't know that you want to or ought to be the ones required to become specialists in this area. If you don't correct the language tonight and make that clear on what you want, we will go into the next 3 months not taking people to the hospitals they may need to get to during the worst months of the year when we're relied on because the aircraft can't fly. So I just want to be clear that that's why I'm here tonight, not at the February workshop or, that Mayor and I talked about whether or not, it's a lot of work. It's a lot of work. And as you dig into these documents, this has been discussed for 20 years. I just don't think that this is something we are going to rush to and solve. But I do think that the best thing for patients that we take care of is that we continue to operate as we have for the past several decades and work on a better solution, carry that forward and get a better thing. So just that for your consideration, and I'll be quiet.
Thank you, Chief. Counselor Spickelmeyer?
I guess with that, my comment to you, Chief, is that we aren't changing anything we haven't been doing for the last 5 years, correct?
We have changed on the mayor's direction. We stopped doing any transports except what's listed specifically in the code. So that was the ask tonight is let's clarify that those were example cities.
Sure. I'd like to make a motion to table this discussion until the February work session.
Second.
It's been moved by Counselor Spickelmeyer, seconded by Council President Kleberg to table this item until the February 2nd work session. It is non-debatable, so those in favor, please signify by saying aye.
Aye.
Opposed?
Aye.
Hey,
Okay, Mayor votes aye. We'll table till February 2nd. Bring it back up for discussion.
Mr. Mayor, do you want me to continue with the exemption to Kootenai?
Kootenai,
The next item,
no. Kootenai, the
To
exemption.
Kootenai County transports, or to Kootenai Hospital.
Chief, yes, please do that.
Thank
That's
you.
within my authority. Thank you. Next up, council, we have item C, agenda item 6C, resolution 2025-55, considering approving an emergency services agreement between the city of Lewiston, Idaho and Asotin County for emergency medical services to the Asotin County Rural Emergency Medical Services District Number 2, and authorizing the mayor to sign the agreement. This is an action item. Chief Reitmeyer, please introduce yourself again for the record. The floor is yours. Thank you.
Good evening, council and mayor. Thank you. Greg Reitmeyer, Fire Chief. Before you, this is a revision of 2025-48 resolution that was passed by the council on October 27th. The agreement had within it a unique financing escalation to help Asotin County have some space to run their levy, and also had some numbers in there and calculations. It was brought to our attention working with Asotin County that our numbers, the data was incorrect. So we've corrected that data, that changed the financial calculations, and also the need for them to have that specialty financing piece in the contract. So I don't know if you were provided a red line version, but essentially we removed in section 6, we removed the pieces of the 3-year escalation of the fees, and then updated the fee worksheet to reflect the number of actual calls that we had in that area.
Councilor Klein?
I would just like a clarification. So would this just be a 1-year contract then instead of a 3?
The terms of the contract are the same. It's a 1 year with renewals. I think it has 3 1-year renewals.
And is that renewal, are we able to deny the renewal or?
At any point in time, we can give a 180-day notice that we want to exit the contract. So that the exit language is in the contract, and we have annual reporting cycles that we report and meet with them.
Follow-up.
Councilor Klein?
So my biggest concern is that the amount of calls fluctuates from year to year, and just, around a $200 drop is pretty dramatic per call. So I'd rather see something that was like an average of a certain amount of years, so it doesn't fluctuate so much back and forth from year to year.
And the fluctuation you see in that one is because our numbers were off so bad. But if you look at for the last 3 years, their calls have been 30, 32, and 39 calls per year. We were 20 or so calls above that. And so that's why you see that fluctuation in the formula. Their transports have been 16, 17, and 15.
Councilor Spicklemeyer?
Thank you, Mayor. So Chief, on our original one, when we talked through dash 48, a lot of it had a lot of talk about, we had figured out how much it cost us, and that was part of how we came up with the number. And the offset showed that with us having them over there, that we were only really paying for, I think it was 25% or 20% of the cost of having that unit. So with reducing that down by $200, does the cost of us having that unit over there change, or we happen to eat a lot more?
So what you're referring to is the Asotin County Fire District contract. This is for the rural EMS.
I understand that,
Okay.
but you gave those sheets to us when we had our private meetings, and we didn't have it in our regular council meetings, so I can't refer to it. But one of your sales pitches on that was that we were going to save so much money, by having those out there, and it only cost us so much to be over there, and with the $799, and the year before, last year, we were at $640, and we're going to drop another $100?
So we were at 640 was the rate we charged, but because we rebated our ambulance transport fees, we ended up with a net of about 380. And so this contract, we still recover all of those ambulance transport fees. So while the number went down with this math, the amount of money that we are recovering went up and will continue to do so in the future. It just, our numbers were wrong for a variety of human problems that exist in the system. And we've corrected those and moving forward with the county to do a better job at.
So you have our cost numbers too?
The cost number.
What it costs us?
The GEMT cost is still the base cost for that. We still multiply that times the number of transports, and then we divide that by the number of calls. It's just that their piece of the pie went from this big to this big. And so it costs less money per call to serve them, but the amount of money that we recover is still more than we were recovering before.
Isn't the Washington GEMT a standard number?
Correct, yes, sir.
But I'm talking about our costs to have those firemen over there. What does it cost us to provide the service?
That's a bigger formula to go at.
But
and get
so
all
we
those
haven't
costs.
looked at that?
Do we have a look at it? I don't have that with me tonight, no.
Have you looked at it?
Have we looked at it? No, that has not been looked at. That requires a time and place study that would involve multiple departments in the city, and it hasn't been done, to my knowledge. It hasn't been done in the 5 years I've been in the city.
So in the long run, we're just hoping this pans out for our taxpayers.
Well, in the long run, we've improved it by using GEMT, using a standard number, and that is a very fancy moment in time study that brings us closer to standard without us having to hire a consultant to come in and do that big study. I can't tell you that it's 100% accurate. It's the best that we have.
Counselor Forsman?
Understand, so we're talking about the cost of having our ambulance in the Asotin Fire Department as well as our paramedic, right? That's basically the question at hand.
I think that's Councilman Spickelmeyer's question, is what is the total cost?
So they pay for that paramedic housing,
Yeah, so
different.
this is not the Asotin County Fire District contract. This is the Asotin County rural area. This is Anatone, Heller Bar, Cloverland, those areas up there that just the county of Asotin created an EMS district because that was no man's land.
Right,
So
don't
they
remember
created
that.
an EMS district, and this just covers reimbursement to go on those calls.
I understand where the housing or people came in then. I don't know where that, I'm not understanding, I guess.
Chief, one of the things that I want to read back to you, because I think it's a question that we all have, and you probably have the same question, but in some information that you handed out to at least myself and I think the council back in September of last fall, there's a statement on there. It says the cost of readiness is not reflected in the current pricing model and needs to be addressed in the upcoming contract. And I think that's probably part of what we're hearing, if not from the council, certainly from me, because as I look at the Asotin County MS Rural District 2, if the numerator goes to 1, then they don't pay very much money for every call that we go over there. And somewhere in that model, there has to be a minimum or a cost of readiness that we charge all of the users of the service, because otherwise, I think we're prone or we're suspect to transferring those costs back to Nez Perce County, to the city of Lewiston. And it's difficult. I'm not sure that we've ever calculated that, but it just appears that the incentive for like the EMS2, right, as the numerator gets smaller, their per run costs go down and they don't pay for that readiness. The flip side of that for Asotin County EMS2 is if they had a very high transport rate, there's a possibility they would come back to us and say, hey, our levy's not high enough, we can't pay for that, we need 2 or 3 years to pay for this. So they would have to set something up, I think, in the alternative, where they could have a reserve to say, we're going to pay for these years when transports are above 50%. And that's borne out by what the current contract states, where they were going to pay 63% the first year, 100%, and 137, I think, in the third year. Because that's how we were trying to work with them, and they asked us to work with them. But I think long-term, where I'm going to be coming from, and I will talk to the council members when they come to me, is that I think we need to have some kind of a fixed rate across the spectrum. So whether you're Nez Perce County, Shelton County, Whitman County, any of these other entities that are asking to partner with us, I think we're going to have to, just in my mind, I've been thinking about this, you and I've had a lot of talks on this, we're going to have to come up with some rate that says this is what the minimum charge is per run, whether we transport or not. And that's capturing that cost of readiness. And that's something that you talk to me about all the time when we talk about minimum staffing and things like that. So I don't know if that's what Councilor Spickelmeyer's getting at, but it's certainly something that I'm interested in, that we continue to look at this and talk about this. So.
Thank you. I believe that the document that you're referring to was the document that we used when we began negotiations with Nez Perce County. And it was referring to the cost of readiness was not captured in the current contract model. And that's why we went to the GEMT-based model, because it did incorporate fuel, depreciation of vehicles, medical equipment, medical expenses, our admin costs and stuff. And so that GMT does account for the cost of readiness. I think as one of the things we've seen here is as we went forward in good faith of trying to have a standardized formula that would work for anybody we contracted for, is we've seen here what happens when there's a small customer that has a very few numbers, and that may be in the future that we need to look at that. We've, in the process though, all of these contracts, we were rebating all of their transport fees back to them. And so all these contracts, we've captured those transport fees for us. So we've brought in $350,000 more next year by just recovering those costs and getting those numbers squared away. So I think that I appreciate what you're saying. We're going to have to continue to look at this. Every one of these contracts is built in that we're going to look at this annually and assess the readiness for us to be able to do this. Or not readiness, but our feasibility. And so I think that, that we may look at that, okay, hey, we need to make sure that mathematically you didn't have one transport last year and then that takes your number down to near zero.
Dave, you're probably right in the sense that with the 9/11 date on this, and it does say Shelton County Rural EMS District 2 at the top, but we may not have set the Nez Perce County contract at this point. But anyway, just to make sure that we're capturing it. Councilor Forsman.
So just so I make sure I'm understanding what we're talking about, cost of readiness, we were referring to maintaining like essential infrastructure. So the cost of the vehicle, the wear and tear on our services and our equipment and our staff on a 24/7 basis. Okay. Thank you.
Councilor Klein.
I just have a comment. I'm okay with approving this for a year. If you take the 63% of the $799.08 that we were going to get before, it's actually less than what the new contract proposes. And as long as we're looking at for future years and making sure that we're getting more accurate numbers in the future, I'm okay with proceeding with this one for a year.
Councilor Spickelmeyer.
And I guess my comment is I don't mean to get down on you, Chief, but my whole thing is I don't see how you can provide a service if you don't know how much the service costs. You know, until we figure out how much it costs us to provide the service, how can we establish or say that number's good, that $500? And if it is good, if we are being covered, I'm 100% for it, but if we aren't, it's not good business.
One thing I did ask the chief for, and is to get a bill from Assotin County. Tell us, what does it cost to house an ambulance and paramedics up there? And if they were to say, well, it costs $1,000 a day, that's $365,000 for the year, send us the bill, we'll write you a check, but then we're also going to charge you, just like we charge everybody else, for the use of the ambulance, and it's nice and clean. And those numbers are going to, I predict it'll net out differently than $400,000 that we currently receive. Then we have to go bill for everything else. We do all the work to get our money back. And so I'd like to look at another model, but I've asked the chief to talk to the fire district over there about that. So, because I think that'll help answer some of these questions.
And I hope that I'm construing that the GMT, that is a complete analysis. I just wouldn't, I'm not comfortable saying that's exactly what it costs us, because it is a standardized thing. And so I don't know that it exactly reflects. And the evidence of that is that GMT in Washington is a little bit less than GMT they came up with in Idaho. So there's going to be some fluctuations. If you've done any of these time study things, they're very intensive, and they're still a guess. They look at you, they look at one day here, and then they make an extrapolation of the data and make a guess. And so I think that's, as we go forward, if the mayor wants us to budget for that and to do that, we'll do that. I'm happy to. I mean, it does nothing but give me better information. I'm at the place where I have to make best information best choices with the information I have.
Councilor Forsman?
I would agree with Spiegelmeier on just further investigating and getting more cost analysis, more accurate numbers as best to the ability as we can, so that we are making sure that we're doing the best for patients as well as taxpayers as well. So I'm okay, like Councilor Klein has said, okay going for the year, but I think during that year we should definitely investigate the cost and do some more data. Get some more data to provide at our next agreement when it presents again.
Councilor Klein?
Can I ask Jennifer a question?
You may, if she's willing to stand for a question.
Jennifer Zunano, City Attorney. What is your question, Councilor Klein?
So my question is, if we just want this contract to be for a year and not to be extended, do we have to modify our motion for approval?
You don't necessarily have to modify the motion for approval. I mean, you would approve it as amended, but you would want to amend the contract itself in section 4, where it says the initial term of this agreement shall be from 1 October 2025 through September 30, 2026. You would want to remove the next sentence that says thereafter this agreement shall automatically renew for up to 3 additional 1-year terms, each a renewal term unless terminated as provided in section 5 below. And then the next sentence as well, each renewal term shall commence on October 1st and shall terminate on September 30th. And then you want to revise the next sentence that says this agreement shall not extend beyond September 30th, 2029, unless mutually agreed to in writing by both parties, and change the 2029 to 2026.
Follow up?
Councilor Klein?
So would it be okay if we just say to modify in section 4 to remove the renewal terms?
You could do, I mean, I would recommend, just for the ease of it, you could do 2 motions. One motion is to make a modification or an amendment. So a motion to amend the proposed intergovernmental cooperation agreement. Then you just say how you want it changed. And vote and approve on that by voice. And then the second motion will be to approve resolution 2025-55 with the agreement as amended. Because the agreement is an exhibit to the motion or to the resolution.
Okay.
Okay, thank you.
There.
Counselor Forsman?
If we just kept it as is, basically if we wanted to change it or not do, we would have to then give them like the 180 days or something in the contract. Is that what I'm understanding? It would make that more complicated because of that route we'd have to take.
That is correct. As is, the agreement automatically renews, but in section 5, it does state either party may terminate this agreement with or without cause upon 180 days written notice to the other party. And so, if you didn't want it to extend for another term, you'd have to do it at least 180 days before September 30th, which would roughly put you in a couple of months from now.
Right, okay, thank you.
So Counselor Klein, in anticipation, maybe if you make a motion, I'm going to guess that on page 2 of the agreement, and City Attorney Tangano, please follow along, if she were to strike everything after the first initial term, then the initial term would just run from October 1, 2025 through September 30, 2026. And that would take care of the amendment. And then if in February, council decided they wanted to terminate that, they could give a 180-day notice, and that would make it end prior to September 30th of 2026. But am I thinking clearly on that?
Not necessarily. We won't have to, if we strike everything after the first initial term, so after that first sentence, I would still keep the agreement shall not extend beyond September 30th, 2026, unless
Okay.
mutually agreed to in writing by both the parties, changing that 2029 and 2026, because if for some reason this agreement wasn't working, we can terminate at any point within 180 days. It doesn't have to be 180 days before the end of the regular expiration date. We don't have to do anything special at the end of the actual termination date because it's already expressed that it's going to terminate on a particular day. There might be other references to renewal term in here, so I see it in section 6, but we can also remove all references to the renewal term because the payment, so in section 6, for the initial term, it starts for the initial term of the agreement, everything after that will have to be stricken as well. Yes, and the fire chief has asked if we could just approve the agreement as is and then direct the direct city staff to send that notice of non-renewal for the end of the current term. And that's another option without having to change any of the agreement as well, so.
Councilors, you heard the request to approve Resolution 2025-55 as drafted. And we can come together after tonight and propose any changes. I can work with the chief on that and bring them back to you. Working with our city attorney might be one way to do it and still meet the intent of what you're asking, Councilor.
And I believe too, Council, that the reason why Chief Breitmeyer is asking that is because he had mentioned too that as a preface to tonight's meeting, he did already get the signature from the Stoughton County Rural EMS District Number 2. So they have already signed that agreement. And in order for them to re-sign it, they'd have to redo their own processes for approving such contracts. So that might be more procedurally, it'd be easier for him to get a fully executed contract.
Counselor Klein,
I'd like to make a motion.
motion's in order.
Okay. Motion to approve, motion to approve resolution 2025-55, directing staff to send notice of non-renewal intent.
Second.
The motion is to approve it, and then what?
Direct staff to send a notice of non-renewal.
Is there a particular time frame, or so long as it's before the end of the term?
Or, yeah, as long as it gets them there in time.
Notice of non-renewal, and what did you say, Counselor?
Notice of non-renewal. As long as it's before 180 day.
Jennifer, are you okay without a date?
So to clarify, is your motion a motion to approve resolution 2025-55 with direction to staff to send a notice of non-renewal at least 180 days before the end of the initial term?
Yes.
Could you repeat that?
Motion to approve resolution 2025-55 with direction to staff to send notice of non-renewal at least 180 days before end of initial term.
And it's been seconded by Counselor Forsman?
Yeah.
Okay. All right, there's been moved by Counselor Klein, seconded by Counselor Forsman to approve resolution 2025-55 with direction to staff to issue a notice of non-renewal prior to the termination of the first term. Is there discussion? Counselor Forsman?
Want to make sure. So this is so that it's clarity for them, because they already signed the agreement. We're agreeing to these terms, but we're giving ourselves that window of time to review data. And then if we decide that maybe the cost isn't there, then we don't have to renew. That's basically, this is the most clean way to accomplish that after our whole discussion, correct?
It is one way to do it, but it's however the council would like to proceed with this particular contract.
Follow up. You had mentioned that they would have to, they already signed, so does this need to go back to them again and then they need to re-sign? Or this allows them not to have to?
They've already signed, so they would not have to re-sign it, and they wouldn't have to go back. The city would then sign it, and the contract would be in effect for the current term.
And then prior to the 180 days, this would be brought to council so that we can discuss it and decide if we wanted to continue.
Well, with Councilor Klein's motion, we would send them notice of non-renewal of the existing contract. And so we would have to create a new contract before the next term, which would be October 1st, 2026, to have a new agreement.
Okay, thank you. Just want to make sure we understood.
Further discussion? If not, Clerk Brockie?
Council President Kleberg,
Aye.
Councilor Wright,
Aye.
Councilor Forsman,
Aye.
Councilor Schroeder,
Aye.
Councilor Klein,
Aye.
Councilor Spiegelmeier.
Nay.
Motion carries. Thank you, councilors. Thank you, Jennifer, Chief Reitmeyer. Council, next we move to Roman numeral 8, unfinished and new business. Item A, city councilor comments. Comments shall not be related to an item currently before the city council or an item that may come for the city council in the foreseeable future and shall be limited to comments, not discussion.
Mayor.
Councilor Forsman?
I recently got a fender bender. Someone bumped the back of my truck. But what I wanted to say for that is I had to file a police report, and it was very easy. I was able to go on the City of Lewiston page, find the police department area, and do it online. And then the next day, I actually even got a call to confirm some information. And I thought that was really good service to have. Also, they didn't have to come out since it wasn't no one was hurt or any major damage. but we have it, I was able to document it with the police department. I also saw, while I was browsing on there, the police department if you go onto the City of Lewiston to the government tab and then go to police department, there is a podcast. So if you want to listen to your chief talk about different things going on, one of the first episodes, the Child Advocacy Center, I highly suggest you do that. I think that's a pretty cool thing that we have now been offering. I'm not actually sure how long we've been having that. And then my other one was I went to see the Civic Theater play. It was amazing, and there was some very wonderful. It was a wonderful production. And speaking of Asotin, the fire chief, I was told, was one of the main characters in the Civic Theater production. So that's really cool to see just our whole community and Lewis Clark involved in providing entertainment and also opportunities for kids that have passion in that or adults. And I hope everyone has a safe and Merry Christmas, and don't drink and drive.
Thank you, Councilor Forsman. Are there further Council President Kleberg?
Thank you, Mr. Mayor. Yeah, on behalf of my wife and I, I'd like to wish everybody a Merry Christmas and a Happy New Year. And Councilor Forsman said, be safe out there.
Council comments, anyone? Next, we have city boards and commission liaison updates. Councilors?
Mayor.
Councilor Forsman?
Historic Preservation Commission met just about last week. I was unable to attend. I had some sick kiddos, and then that windstorm closing schools kind of took out my schedule. So, but they did talk about they're reviewing some historic churches, and churches have submitted their responses to be a part of the historic church program that they can then see and document. And then they also have an open seat on the commission and are encouraging commissioners to share with anyone they know who might be interested in joining. It's a pretty cool group. You get to learn a lot about the history of Lewiston and all the buildings and why they are so passionate about keeping the history alive there. And so I highly suggest you share that, please. Is all I have for my boards and commissions.
Councilor Wright?
Yes, we had the DAC meeting, Disability Advisory Commission. It was on December 11th. We coordinated the transportation plan update, and really what that was a discussion with Kittleson and Associates, Inc. on the coordinated public transit human services transport plan. And some discussion topics around, lack of transportation and issues in that area and how they could help support the city with the plan. Then the letter of support for a grant, City of Lewiston Public Works was seeking a letter of support for an application to their 2026 Transportation Alternatives Program, or TAP, and we issued that letter of support. And then there was a Emergency Communications Joint Powers Board meeting that was on December 17th. There are a few different areas of topic, but the two main ones that could be more relevant to us, there's the move of hardware that'll be coming up here soon, trying to get that hardware moved out of the Bramer building over to the courthouse is the location where that'll end up. And that's the backup connection, or the connection for the backup dispatch center, is my understanding. And the backup site was tested and works great. Lewiston Police Department said that it met their needs. That's all I've got.
Thank you, Councilor. Further comments, councilors, commission liaison updates? None. Okay, mayor comments. First of all, if you have not turned in your preferences for appointments, for councilor appointments, Clerk Brock is still taking those. We need everyone to take 2 to 3 appointments at least. We have a lot to cover, and if we don't get them filled, then I think council's going to have to probably ask themselves if they want to keep these commissions or boards because I hate to not be there and show interest in it. So if you haven't done that, please do so. Then also, just to let you know, counselors, City Hall, meaning the City of Lewiston, will be open tomorrow for business, Tuesday closed, Wednesday, Thursday open again Friday, and that is all of our offices except for emergency personnel, public safety. They're on duty, on the clock all the time, so we thank them for their service for that. Counselors, item D, agenda topics. Counselor Speckelmeyer?
Yep, Mayor, I guess one of the only issues I get asked or questioned about more than taxes is our vacant retail properties in Lewiston. I'd like to make a motion to add the discussion about vacant retail properties in Lewiston at our February workshop.
Counselor, you're talking about vacant city property?
Vacant, not nobody in it.
Vacant retail?
Yeah.
Okay. Okay, it's been moved by Councilor Speckelmeyer, seconded by Council President Kleberg, that we add vacant retail properties to our February work session. Is it February 5th? Is that what it is, Tanya? February 5th work session. So those in favor, please signify by saying aye.
Aye.
Opposed?
Aye.
Motion carries. We will add that to the agenda. Thank you, councilors.
I wasn't opposed, sorry if that, I didn't want to confuse. I was an aye. I said it kind of late, so sorry, but I didn't want to confuse you.
Councilors, next we move to Roman number 9, adjournment. This is an action item.
Second.
Been moved by Council President Kleberg, seconded by Councilor Schroeder to adjourn. Those in favor, please signify by saying aye.
Aye.
Opposed? Carries. We are adjourned. Thank you, council.